All of you. I am Dr. Kaushik Chatterjee, an Associate Professor, Department of Oncology in IPGMER and SSKM Hospitals, Kolkata, and I also see my private patients in Bellevue Clinic, Ruby General Hospital, and Narayana Hospitals. Well, today is our time to make you a bit aware of this disease known as lymphoma. Basically, it's a cancer which is arising from the lymphatic structures, and sometimes it also affects the extra lymphatic organs and sometimes the bone marrow as well. So what basically happens is there are multiple glandular swellings in the body, and sometimes there is some kind of weight loss and vague symptoms like fever with night sweats. So these are basic presentations. So there are mainly two types of lymphoma. One is the most common variety, that is the non-Hodgkin's lymphoma, and the other is the Hodgkin's lymphoma. If you look at the differences of the incidences, roughly around in the United States, you have 70,000 cases of non-Hodgkin's lymphoma every year, as compared to only 8,000 cases of Hodgkin's disease. Now, the basic difference is basically a pathological difference, and the pathological difference is the finding of a special kind of a cancerous cells known as Reed-Sternberg cells. When this Reed-Sternberg cells are present, they are termed as Hodgkin's lymphoma, and when it is absent, they are called as non-Hodgkin's lymphoma. So, basic kind of presentations for Hodgkin's lymphoma is the central distribution of lymph nodes, whereas as compared to the non-Hodgkin's disease, it's more peripheral distribution of lymph nodes. Extra lymphatic organs are more involved in non-Hodgkin's lymphoma. However, saying that Hodgkin's disease has two kinds of peaks of age. One is a bimodal peak, one between say 20 to 34, the other is above 55. For non-Hodgkin's disease, it is mostly presenting roughly around 50 above, average age being around 60, 65. So that's what I said. The presentation comes with glandular swellings, and especially in Hodgkin's lymphoma, the glands feel very rubbery. So we can basically touch and understand this could be a Hodgkin's lymphoma. But however, we have to come to a conclusive diagnosis, and that is done by a biopsy where a complete node is removed and it is seen under the microscope. And the findings, along with findings of immunohistochemistry, it helps us to understand whether it's a Hodgkin's disease or a non-Hodgkin's disease in the first place. Then it is basically classified based on the Hodgkin's lymphoma can be NLPHD or a classical. The classical Hodgkin's lymphoma is further divided into four types. The most common being nodular sclerosis, mixed cellulatory, the lymphocyte depleted, and the lymphocyte enriched. So these basic differences between the patterns is made by the background, histopathological background, and the IHCs, and similarly the different type of non-Hodgkin's lymphoma are also categorized based on specific immunological or immunohistochemistry markers. So after we have diagnosed it with a biopsy, we go about staging the disease. The anaerobe staging comes with some radiological investigations like CT scans. Often PET scans are done, and sometimes bone marrow trifine biopsy as well as aspiration cytology is required. After we come to a diagnosis, we basically treat the patient with chemotherapy. For Hodgkin's disease, the chemotherapy is ABV regime, and for non-Hodgkin's lymphoma, the chemotherapy is CHOP regime. If CD20 is positive for non-Hodgkin's lymphoma, then we treat the patient with additionally with a monoclonal antibody known as ipsumab. And whenever there is residual disease after the treatment or the initial bulky disease at presentation, we also give radiotherapy. But however, saying that, it is a good disease to have because the prognostic outcomes of lymphoma is very good. Basically, awareness about this disease is very important. Whenever you have a low-grade fever with glandular swellings, you should definitely go and talk to your physician and think lymphoma in your minds.